All right, everyone, welcome to week 2. Our title this week is Human Responses. And we're looking at the questions of how humans behave and respond to times of crisis and shock. We will have with us today Dr. Rebekah Wanic, Dr. Mary Barger, Dr. Justine Rapp Farrell, and Casey Dominguez, who most of you guys have already met because she is coordinating this class with me as faculty. We will start, as we did last week, with each of our faculty members kind of explaining really briefly in a sentence or two how they define their discipline and how they tend to look at problems and big issues like what we're dealing with today with the pandemic. So we can start with Dr. Wanic, and she can give us a little clue and insight into her psychological sciences field.
Sure. So hi, everybody. I'm Rebekah Wanic, as they said. So from psychological sciences perspective, what we look at is using the scientific method to explore behavior and psychological processes. So the things that people do that we can see and what's happening underneath the surface, what we can't see. And so psychologists tend to focus on how the individual responds as a function of who they are and the situations that they find themselves in.
Great. Dr. Barger?
I'm Mary Barger. I am both a nurse, a certified nurse midwife, and an epidemiologist. So this is the first time in my life I haven't had to explain what epidemiology is, since everybody seems to know what it is these days. And so obviously we look from a population perspective at disease occurrence. And with a nursing lens, we try to take a holistic response to looking at all parts of the population and how it's affecting them, and not only at an individual level, but from a public health level as a population as a whole.
Hi everybody, I'm Justine Farrell. I am in marketing, which lives in the School of Business. Marketing in general actually kind of is a combination of a lot of different fields: psychology, sociology, anthropology, and we take all of that theory and apply it into the business sector. There's consumer behavior, which is what I focus in, of how consumers interact with the world and the marketplace, but marketing also has elements of strategy and elements of analytics as well. So today I'm going to be talking about the consumer behavior and how we relate that to pandemics.
You met last week my colleague, Dr. Tyrrell, who is in the international relations side of the political science and international relations department. He gave one definition of what we do in our field. I'll give a slightly different one. When we study, political scientists study power, who gets it, how it's used, and in democracies, you know, my field of study is about American democracy and American politics, and so the acquisition and use of power naturally revolves around elections, and so that's my focus in American politics, and it's what I'll be talking about today.
So I wanted to start by just asking us to think a little bit about this term that people have been throwing around quite a bit, which is unprecedented. And for most of us, the situation that we're experiencing is by definition unprecedented because we haven't experienced it before. But dealing with widespread threat of disease, dealing with global challenges is in fact not unprecedented in any way, shape, or form. It's something that we've been dealing with both in the recent past and in the past in much longer timescales. And so what I want to focus on in my talk is looking a little bit at this idea of the importance of disease, both for creating cultural differences, and then as those cultural differences manifest themselves, how they in turn influence the way that we respond to a disease outbreak. So to get started, I'll go over some basics of what do I mean by individualism and collectivism, which are part of the title. Then we'll talk a little bit about the hypothesis that the differences in cultures in where they fall on the individualism, collectivism spectrum are the result of historical exposure, differential historical exposure to pathogens, and then end looking more present day at, given that these cultural differences exist, how do they manifest themselves in different responses to the pandemic. So there's been a plethora of cross-cultural research in the recent decades, but it actually is a relatively new area in psychology. And one of the early figures in cross-cultural psychology was Geert Hofstede. And what he did was he studied different cultures in an attempt to sort of classify them. And psychologists like to classify things, we like to label things because it helps us to be able to better explain and therefore predict people's behavior in other situations. So the scheme that he came up with is these 6 different dimensions that are useful in describing the ways that cultures differ. And each one of them is a spectrum. So you can see at the top here from low to high. So you can fall anywhere in between the 2 extremes. And what we're going to focus on for my purposes here today is the second dimension, which is individualism and collectivism. So one of the things I want to just make as a caveat before I get started is that obviously within a culture, individuals can differ in the extent to which they adhere to the cultural norms. So when I'm talking about an individualistic culture versus a collectivistic culture, I'm talking about the larger overriding cultural norm, but recognizing that individuals within that culture might differ. But these terms are sort of self-explanatory, and I think they're things that many people have encountered before, but in case you hadn't, or just to clarify, I just want to go over how I'm going to be using them for the purpose of the talk. So collectivism is a focus on the collective, the group. And the idea is that the overarching goals of the group, the concerns of the group are what's paramount. And so people are oriented towards engaging in behaviors that work not to the benefit of the self, but to the benefit of the group. And part of what follows from that then is an emphasis on conformity, fitting in. And we can contrast that with individualism, which is focusing on independence, being someone who's self-reliant so that the goals of the individual then become paramount, focusing on choice, autonomy, and fostering a sense that non-conformity is something that is valuable. And so again, remember that these are on a spectrum, so it's not that you're a collectivist or an individualist and that cultures are either really collectivistic or really individualistic. There's a spectrum on which cultures fall. And so one of the ways that we can divide people into cultures is just using countries as a simple proxy for different cultures. So this map here is designed to just give you a feel for the spread of individualism and collectivism. The countries that are darker purple are those that are more individualistic. So you can see the United States is very, very dark purple, the UK, Australia, relative to what we typically associate with collectivism, which is some of the East Asian countries. But you can also see that the countries in the equatorial regions in both South America and Africa also score higher on measures of collectivism. So I said that we were going to look at 2 things, one of which is where do these cultural differences originate from? And so one of the courses that I oftentimes teach is evolutionary psychology, and evolutionary psychologists look at things with an eye for how our historic past shaped the behaviors and psychological processes that we engage in currently. And so you might be familiar with some of the ideas of evolutionary psychology because it talks a lot about sex and dating and mating. Why do we find this or that particular type of person attractive? But before we can even get to the point where we're going to mate with somebody, we have to make sure we can survive. And so survival and adaptive challenges associated with survival have shaped a lot of what we see in terms of human behavior. And psychologists have coined this term, the behavioral immune system, to encapsulate this idea that there's a host of mechanisms, psychological mechanisms, that supplement the biological immune system to help keep us safe from disease. And I have this picture of Calvin here making a disgusted face. And so the idea is the emotion of disgust is one part of the behavioral immune system. Typically when we feel disgust, we withdraw, which is putting space between us and the thing that is disgusting. And so as a consequence of that, will be less likely to be exposed. So there's a lot of ways that individuals are shaped by the behavioral immune system, and one of them is memory. So what research evidence suggests is that we are more prone to pay attention to and therefore remember information associated with exposure to pathogens. So what I'm showing you here is data from a set of studies where participants were shown objects, and the objects were paired with an individual who was sick or an individual who was healthy. So for example, a pair of glasses and you were told that they were worn by somebody who had a rash, or a hat and you were told that it was worn by somebody who was perfectly healthy. So then participants were given a subsequent memory test where they were asked to remember who the individual was that was paired with the object. And what you can see if you look at the graphs is on the y-axis is the proportion correctly recalled. So the higher the bar is, the better the performance. And for both of these sets of studies, so the graph on the left is participants from the United States, and the graph on the right is participants from Portugal. In both sets of individuals, we see better memory for the objects paired with the individual who was sick. So on an individual level, we're primed to pay attention to things that could help us avoid danger. Another way that we can help ourselves avoid danger is by cultivating a set of values that will help to orient us towards engaging in or avoiding certain types of behaviors that might otherwise lead us to expose ourselves to danger. And so one of the things that researchers have done is looked at the connection between disgust sensitivity. So how prone am I to feel disgusted when I'm told about various things such as feces or vomit or types of behaviors that people engage in? And they connected that with your political orientation by just looking at liberal to conservative. And so in this study, the data that I'm showing you here, this is just participants self-reporting what their political identification is from very liberal to very conservative. And then they completed a disgust sensitivity scale. And what you can see is that there's a very strong relationship between experiencing greater disgust and an orientation towards being more conservative. So the term conservative incorporates a lot of different aspects of politics, but in this domain, what they're focusing on is the fact that conservatives tend to be more wary of individuals who violate norms, and particularly norms associated with things that some people find to be disgusting, for example, different types of sexual behavior. And the picture is even a little bit more nuanced because if you break conservatism down into social issues, foreign policy, and economic conservatism, the relationship is strongest for conservatism related to social issues and weakest for conservatism related to economic issues. So the relationship tends to make sense. So what I'm building towards is if we kind of take this at the larger level of culture, then again, the cultural norms and values might also be something that can help to protect us from exposure to pathogens. So if we go back to thinking about collectivism relative to individualism and why collectivism might be better suited to protect us from exposure to pathogens, one thing is orientation towards the group interest is parallel with orientation against members of the outgroup. So xenophobia and wariness of outsiders, well, from a pathogen exposure perspective, that's good. Outsiders are going to be the ones who are more likely to introduce me to an unknown pathogen. So if I tend to be wary of them and keep my distance, that helps to keep me more safe. The other thing that we mentioned is this focus on conformity and tradition in the context of collectivism. And what that works to do is control people's behavior and make it so that other members of the group aren't necessarily engaging in behaviors that are going to expose me as a group member to potential pathogens by doing things that we as a group don't approve of. So it seems plausible on the surface, but we want to know, is there actually some data out there that suggests that this is the case? So in one of the articles that we asked you to read for this week, they talked a little bit about some of the research that's been done in this area. And there is some solid evidence from multiple studies suggesting that cultures that are more collectivistic were exposed to more pathogens in the past. So if we look at the graph on the left here, what you can see on the x-axis is historical pathogen exposure going from low to high, and individualism and collectivism on the y-axis, higher scores, meaning more individualistic. So what you can see is that the more individualistic cultures were exposed to fewer pathogens in the past. And then this newer study by Morand and Walther from 2018 also looked at currently individualistic versus collectivistic orientation and the likelihood of experiencing an infectious disease outbreak. And what you see here is that as we go from low to high on the x-axis, we're seeing that more individualistic cultures are in fact more susceptible to infectious disease outbreak. So both of those square with this perspective from evolutionary psychology that at least in part differential historical exposure to pathogens shaped the individualism collectivism dimension. So that makes sense, but we also said we wanted to look a little bit at how individualism and collectivism might influence people's behavior currently. And there's a lot of things that I could focus on here, but I'm going to talk about two things: masks and haircuts. So masks, when we first started hearing about COVID, were something where we had a lot of mixed messages. Masks aren't helpful. Then we heard masks were helpful. Now the consensus is that wearing masks can help slow the spread. So what I'm just showing you here is data from a mathematical model that's looking at two things. One is the efficacy of the mask, so how well does it protect from the virus? And the other thing on the y-axis is what is the adherence rate? What proportion of the population is wearing masks? And so what you can see here is that the more effective the masks are and the more likely people are to wear them, the slower the spread of the virus. So what we can look at then is, does mask wearing, which is largely oriented towards protecting the rest of the group, differ as a function of the country and individualism, collectivism as a cultural variable in that country? And so if we look at the data on the left here, what we see is that individuals in Asian countries, which tend to be more collectivistic, are more likely to wear masks in public, very, very high levels of compliance relative to the United States and the United Kingdom down here that are much lower. This graph on the right, the blue line is what we kind of want to focus on, which is survey respondents saying that they do not wear a mask out in public. And although it went down slightly over the course of the last few months, meaning that more people are wearing masks, it's still above 50% in the UK, which is a very individualistic culture. So the question then is, why is mask wearing something that people are going to be different on as a function of individualism versus collectivism? Well, if you think about it, being asked to wear a mask is being asked to do something that is conformist. And so that's something that a more collectivistic culture tends to be more oriented towards. There are obviously other variables at play here. One of the things that we see in the United States is how politics becomes involved in whether you do or do not wear masks. And another thing that's important is prior exposure, familiarity with wearing masks. So in many Asian cultures, people have been wearing masks in response to feeling sick themselves for many, many years, whereas it's relatively new in a lot of other cultures. But I would argue that individualism plays a role in people fighting against the instruction to wear masks. So the other thing I said I wanted to mention just briefly is haircuts. So we've seen in the United States a number of protests about social distancing, about what businesses can and can't be open. And a couple of months ago, there was a woman on almost every TV program who was taped saying, who is the government to tell me that I can or can't get my hair cut? And so the question is, why this push, this need to get haircuts? People in Michigan staged this hair cutting right in front of the government buildings. Why? Why focus on that? And what people have argued is that your hair is an important part of your outward expression, which shows who you are as an individual. It's a way that you can establish your identity. So from that view, then it makes sense that individuals from cultures that are higher in individualism, like the United States, would be really focused on engaging in behaviors, wanting to be able to engage in behaviors that allow them to show their individual identity and to express their autonomy. So one of the questions that we asked you to think about for the discussions coming up later on this week is what I have here as a question from an article: have we become a collectivistic society because of COVID? And I think the answer to that question is no. But the more interesting question is, will COVID and our experience with the pandemic orient us towards being more collectivistic? And I don't have an answer for that. That's one of the reasons why we wanted you to think a little bit about it for the discussion. But one of the things that I would challenge you to think a bit about is that we have these ingrained norms of behavior, and it's highly unlikely that one particular event is going to cause a gigantic shift, but it might make incremental changes. So I just wanted to give you a brief overview of some of the ways that psychologists might look at the human response to the pandemic from the evolutionary psychology lens. So I will now turn it over to my colleagues who will tell you a little bit more about this from the public health, political, and economic perspective. So
does the public trust or not trust the people who are giving the message during an epidemic? First of all, I wanted to think about what kind of epidemics generate a social response, because not all epidemics do so. So we have Ebola, which I'm going to use as a case study for an epidemic. And Ebola, during the last epidemic of Ebola, there were 50,000 cases and it killed half of the people that infected. So that was clearly something that people were afraid of because of the high mortality rate. We didn't have a vaccine. We only had supportive treatment. So that's part of what would play into that. On the other hand, we have tuberculosis, which of all the things we're going to talk about of these choices is going to kill the most number of people in the world this year. So it will kill 1.3 million people in the world. However, tuberculosis is something we know what it is. We know how it's transmitted through aerosolized coughs or breathing. And we have treatment for it if you're lucky enough to live in a country that can afford the medications. And we have sort of a vaccine, not really, that does provide some protection. We also have cholera. Cholera is has a mortality rate of 50% if you get it and you live in a place where there is absolutely no treatment. However, if you get it and you are in a country that has a relatively, even not relatively, but some sort of healthcare system, we can provide you supportive therapy during the time you have cholera so that the mortality rate goes from 50% to 1%. But we've had cholera outbreaks that come and go. It has become what we call endemic in many parts of the world because it lives in the water in places that are sort of brackish or have bays that don't clean themselves well. And so people sort of learn to live with it. It's not an unknown disease. We have HIV, which will kill 750 million people this year around the world. When it first came, we didn't have any idea of what caused it. We now understand what causes it. 20 years ago, Anthony Fauci promised a vaccine in 3 years, and we still don't have one. So it's a disease that we don't have a vaccine against, but we certainly have treatments that have now converted this from sort of an acute disease and one that people die of to a chronic disease. And then lastly, we have SARS and coronaviruses. SARS certainly was a disease epidemic that we all recognized as an epidemic. It infected 8,000 people, and its mortality rate overall ended up being only 15%, it was 15%, which is very high. But for those who were over the age of 55 or over the age of 60, it killed 55% of those people. So it seems that what we respond to are unknown diseases, things that we're not familiar with, things that have a rapid death and a very unpleasant death, those tend to be the things that catch our attention. So so I'm going to talk a little bit just about the bubonic plague, because I think it brings up some of the issues that are that have been raised and will be raised. And I want to start, the bubonic plague started in Hawaii, where it came to a Chinatown, which was approximately 10,000 Chinese living in an 8-block area of Honolulu. They had very poor sanitation, poor clean water. I mean, they were completely denigrated by the rest of the population. And when it came, they sent armed guards to quarantine it. Well, of course, the rats didn't pay attention to the armed guards. And when a white teenager got bubonic plague and died, they decided that they would burn down a certain number of buildings. And so they did a burn, and that didn't contain the plague. So on January 1st, they did another burn, which ended up in that complex, ended up burning 1/5 of Honolulu over 18 days. So it ended up in really a tragedy. So then it wasn't long before those rats got on boats and went to San Francisco. Bubonic plague had not been seen in the United States before. Again, the same response, cordon off Chinatown with guards, but of course the rats didn't pay attention. And there was a public health officer who had been sort of sent to Angel Island and to San Francisco because he was making trouble for his bosses. And he had a lab where he was one of the first people to say, this is from rats. And he identified the fleas were the cause of it, and started collecting rats and killing them as a way to control it. But there was a lot of discrimination against the Chinese, a lot of send them back where they came from, and that sort of thing. And the governor of California wanted to deny there was a problem in San Francisco because he wanted the railroad people and the other business people to continue to support California. And he and the newspapers together sort of put out this propaganda that really the city was safe, there was no plague there, the danger of the plague had passed. And this is despite a report from the public health officer that said, no, we still have plague. And it wasn't until Sacramento newspapers sort of highlighted it that they really came and dealt with it. So, so we get politics in pretty much all this. So politics in an epidemic is not unusual, and blaming a particular group is not unusual. And so Rosenberg sort of talks about the unfolding of epidemics. So in the first act of an epidemic, you sort of have this progressive revelation. People ignore the clues that there's a problem. They try to sort of not think that, oh, this really isn't a problem, until it sort of increases. And then people want to start, sort of explaining, why is this, whatever disease it is, increasing? And typically you'll come up with moral or religious explanations. That's happened in the past. We will come up with victim blaming for particular groups. And once we realize that it's really here, then we'll sort of get to the point where we negotiate a plan and formulate a plan of attack. and this is sort of what happened in Sierra Leone. So in Sierra Leone, it was, Ebola had never been seen before. The public didn't recognize it as a new disease because some of the symptoms were very similar to endemic diseases in Sierra Leone, such as cholera and malaria. Once they noticed that about this disease and people were dying and they were bleeding, they said it attributed it to a lot of superstitious causes. They started stigmatizing certain groups as a way of explaining the randomness of people getting the disease. And then there was, once the government tried to tell them this was a disease, there was a lot of lack of trust because historically there was a lot of corruption in the Sierra Leone government. So the people didn't trust anything that they were saying. And this lack of trust extended to the foreign workers. And so as a consequence, the public sort of distrusted any of their advice. There were a lot of conspiracy theories. The government was making this up so they could make money from all these foreign people bringing in foreign aid to the government. And then this extended to the newspapers and the public, people who were in TV who also mistrusted the government. And so they focused on, is the government going to make good use of the resources instead of focusing on how can we message this? There was really confused messaging. On the one hand, the message was Ebola kills, and on the other hand is if you get Ebola, go to one of the health centers. So people are like, well, if it kills, why am I going to a health center? If there's nothing you can do for me, why shouldn't I stay home? And then once you went to these health centers, there was black tarps all around them so people couldn't see in. So they, of course, made up of what they were doing to people in those kinds of things. So there was a lot of confused messaging. And as a consequence, I just want to show you this. This was an epidemic, as you can see here, classic epidemic curve of the outbreak in Freetown at a fisherman's festival. Well, one person from another city came to, because someone in their family died here, and the man got sick. So at this point, they have surrounded Freetown with armed guards, but of course, people are trying to escape. When the guards get them, they say, well, why are you leaving? And they say, well, we're feeling cooped up. We don't want to, we're cooped up here. Or we're not getting food. We're not getting our food on time and we're hungry. So this one man decides to flee. His sister pays a taxi driver to send him 250 miles away to another town where he develops symptoms and goes to several local, I don't want to use the, local healers to heal him. And as you can see here, he then, in that meantime, infects a whole nother group of people. And then there's third and fourth generation of the epidemic continues because this one guy fled from Aberdeen. So very typical of what can happen when you don't have public buy-in. You have distrust of the government and the use of armed guards instead of trying to get the public on your side. So we use quarantine when we have a very deadly disease that's highly infectious. I have to say this is the first time really in history that we've asked people to voluntarily sort of quarantine for a less deadly disease. And our choices really are, do we send armed guards or do we ask for voluntary quarantine. And in fact, in Wuhan, China, their initial response was armed guards. But again, that was, they learned quite quickly that wasn't the right way to go about it, because again, people decide that they wanted to escape and leave. And so the government changed its course to rely on what Dr. Wanic said, collectivism, and to get the public on their side through ultimately through messaging and appealing to people's sense of the group. So what do we do if we have a disease, and if we have a disease that is increasing or causing an epidemic? So I think you all learned about R0, and what the R0 is how infectious is a disease, and we want that number to be less than 1, and it will die out. If it's greater than 1, it will not. And that depends on a whole host of things. How many people are susceptible in the population? What's the incubation period? And especially the period where people don't have symptoms. How many people do we come in contact with? And then what's the rate of disappearance of a case, like recovering or dying? Excuse me. So what we are trying to do when we say we're flattening the curve is we're working on this, decreasing the contact. And so that's really where we're at. Right now, we think that COVID has an R0 of between 2 and 2.3. And if that is the case, it would require that we have about 50% herd immunity for this infection to quote unquote die out. We're certainly nowhere near that as a nation. New York probably has around 15%. California, we're around 5%. I don't know what the new numbers, maybe some places are going to be higher than that, but probably not higher than 15%. So that leads us to our traditional approach, which is contact tracing. And with contact tracing, it requires several things. Number one, you have to have a strong system to monitor the disease in the population, which normally we have, but we took us a while to get up and running. Then you have to be able to trace the people who are cases. That means that you have trained tracers who speak many different languages, because we speak many languages in this country. The people, you have to be able to have an address and a phone number to actually locate people. So the question is, do they have an address? Are they homeless? Are they willing to give you your address? If you're going to call them, do they have minutes on their phone? And you can only do contact tracing either early in an epidemic or late. You can't do it when you have so many cases. It's virtually impossible to follow up, because principle of contact tracing is that you contact the contact within 72 hours. So you can't have a lot of cases in order to do that. And then you have to have some sort of treatment for the people who are potentially infected. So first of all, we have to have rapid testing, which may or may not be a reality. It has to be available, not in a place where you need a car, and it has to be at a cost that people can afford, i.e. free. And then if you're going to isolate people for 2 weeks, you have to provide them food, some sort of support, maybe a place to stay if they're living in a 2-bedroom apartment with 2 families. That's not really a very viable thing. You have to contact their employers. So it is very iffy about using this particular approach, especially for disease that has a long incubation period and very low symptoms, so people don't know they're infected. In fact, in the UK, 2/3 of the people who were contacted refused to cooperate with the recommendation. In New York City, through contact tracing, less than 45% of the people with positive tests gave information on their contacts. And they were really only able to contact 1/3 of all the actual contacts they did have. So contact tracing may not be our way to go. So we're left with risk reduction strategies. So physical distancing is our main risk reduction strategy by far. I mean, staying away from people is the way to reduce risk. Frequent hand washing, obviously, use of face masks or face shields when physical distancing is not possible. But again, face masks should not replace physical distancing. And then we have to make some rational decisions about social activities. The American Pediatric Association has absolutely said schools must start because it is doing a lot of damage to children, and to be further behind in their education is impeding their growth and development in very serious ways. Should workplaces open or close? And then what do we do about businesses like restaurants and bars? It's not, I mean, drinking is not a social distancing activity, and we need to limit those. And so should we do financial support for bars to stay closed? That could be a solution. In summary, key requirements are surveillance system, consistent public health messaging, and presence of an emergency supply and distribution system that's equitable. With 50 states all competing for limited resources has been a huge problem. And really, there needs to be a national response to this and not one state bidding against another state. And we need to ensure there's access for healthcare for all those who are ill. If you lose your job, as many have, you lose your health insurance in this country. So that becomes a huge problem. You're then, are you going to go to the hospital or to the emergency department if you can't afford to pay for it? And the key principles I think that we should discuss, and I'd like to discuss when we have our discussion groups, are these are the 3 key principles of risk communication. Integrity, establish trust. As the example of Ebola, there was not that trust there. So it's really key that you always tell the truth. So saying masks are useless, use masks, sends a really mixed message, and then opens us up for this whole dialogue. We need to keep an open dialogue, but we need to know that our perceptions are shaped by our age, our education, and our experience. And people need information proactively and repeatedly. And we can't overpromise, we can't be overconfident, we can only say what we actually know.
So I'm here to talk about how our political system in the United States responds to shock, particularly in the context of presidential elections. This is the kind of question that political scientists answer and ask all the time. It's a really important question. How do our voters make sense of shocks to the system, be they economic shocks, pandemics, other kinds of changes, either good or bad? One of the things to just sort of point out to begin with is that we live in a democratic republic, and that Republican government doesn't just work. There have to be certain conditions in place that make it work. So, for example, democratic republics around the world can only exist as long as and as well as the government is effective. A completely ineffective government will be perceived by its own public to be illegitimate, And such situations are ripe for revolution, authoritarian takeovers, various kinds of bad outcomes. So it's really important that democratic government be effective. It's also important that in a democratic republic, the public has the ability to hold the government accountable for its effectiveness, to communicate to the government, you are being effective, we will reward you. You are being very ineffective, we need to throw you out, right? There has to be that kind of accountability mechanism. Otherwise, the government will not actually be held accountable for its effectiveness, and it will eventually cease to be effective. In order for that to take place, the public has to have some kind of rational reaction, right? So if things are going really well, they should reward the people who are in power, or to make new demands of them and then see that those demands are met. If things are going very badly, there should be some kind of accountability mechanism for that too. There should be a way to throw the people out of power who are doing a bad job. And so these processes need to work properly. These are questions that we ask in political science, not, political theorists will ask what kinds of, government is best for humans of various types, what kinds of structures need to be in place. And then we ask all kinds of empirical questions about looking around the world and at the United States and in our history. Under what circumstances has government responded effectively, been effective, been very ineffective? Those kinds of questions. So we have a lot of evidence about how the American public responds to crises. I'm going to give you 3 points to think about how the American public the American voters in particular, have used elections to respond to crises. In general, American voters, like people, which we are, like to make political decisions based on as little information as possible. And when you think about it, that's actually a rational response, right? This is like, I got a lot of things going on. I got to make dinner. I got to teach my kids to do math. I got to, help out in my community. I got to visit my parents, right? I've got a lot of stuff going on. I only have so much bandwidth to pay attention to what those people are doing in Washington or Sacramento or in City Hall. And so whatever is the least amount of information, it makes sense for me to try to find really simple ways to be able to tell, are things going well? Are things going badly? Do I like what the people in power are doing? Do I vote them in, vote them out? However, those kind of snap, ill-informed, heuristic-based judgments might not necessarily allow the American political system as a whole to capture the nuances of, well, okay, so things are going badly, but is that really the fault of the people who are in power? Or things are going badly here, but whose fault is that really? Is it local government? Is it national? Is it state? Right? So people are going to maybe miss some of that nuance and hold maybe the wrong people accountable, or hold them accountable in the wrong ways in order to achieve actually better outcomes for the country as a whole. So how does the American public respond to crises? This is where I'm going to give you a couple of 3 points here. I'm going to talk a little bit about evidence that the American public has tended to rally to the president in certain kinds of crises. The American public has tended to hold the president accountable for results, though maybe not in a collectively rational way. And that the American public, especially today, tends to react to any piece of information with a highly partisan response. So just looking at past that, we're not necessarily thinking about the current response, but sort of looking at how these patterns of how Americans have responded in the past can help us see with a little bit better perspective what's going on today, and why is the American public making the response, having the responses that it is to our current situation. So let's begin with the tendency to rally to the president. This is a reaction that posits that the president represents the nation, and there is some threat to the nation, and therefore we will rally to the president as a singular, a singular point of focus and communication against this other. And this is a function of our president's sort of weird role, a dual role that not all chief executives around the world have, of being both the head of the executive branch of the federal government, which often gets talked about as like, well, he runs the country or he runs the government, or like, I don't even get me started on how wrong that language is. He is the head of the executive branch of government, of the federal government, but he is also the ceremonial head of state, right? So when there's, you know, a basketball team that wins the championship, they meet with the president. The Girl Scouts who sell the most cookies meet with the president. You know, he represents us at international summits and that kind of thing. So because of those dual roles, when there's an us versus them kind of situation, there is a public rally behind the president. This has tended to be mostly in international affairs. You can see here the biggest rally that ever took place was when the public rally to George W. Bush in the days right after the September 11th terrorist attacks in 2001. His approval rating at the beginning of September was just about 50%, and it shot up 40 points over the course of about 2 weeks. Both because of the terrorist attack on the United States, but also because of Bush's response to it. And his approval rating then stayed high through the midterm elections and even through his own reelection, right? So there's no question that his response to 9/11 caused the public to rally to him in consequential ways that helped his agenda and hold him and his party retain power for several years. So these rallies can be really important, and they can have election outcomes. Donald Trump has not benefited from any kind of similar rally in the public, and there's several potential reasons for that. He went up maybe about 3 points in the end of March, early April. And that was, if you remember, these months kind of blend into each other, but he was on television a lot at that time, and he was talking about the virus, and he was up there with Anthony Fauci and Deborah Birx, and you know, they were having these pandemic you know, television press conferences every day. But this really hasn't turned out to be the same kind of reaction. It hasn't been an international crisis. It hasn't been like the moon landing or by the 9/11 terrorist attacks. This pandemic has not necessarily turned out to be a rally of the United States people against some common foe. Now, it could have been. There's nothing that says it couldn't have been us versus the virus. Or even us versus China and the virus. But that really, you know, to the degree that the president tried a little bit to turn it into an us versus China situation, that didn't really seem to take hold. And he never really tried to make it us versus the virus, right? That was never really part of his framing. And so what the consequences of that is he was never really able to rally the American public to him. Now, again, there are some other reasons for that as well. So that's one part of the background here, is that this could have been a rallying moment and it wasn't. How about the question about how the American public held the president accountable in the past for the events of his presidency? It is the case that the American public has tended to kind of reward presidents for good things that happen and punish presidents for bad things that happen. Not entirely rationally, but there's a little bit of a, well, this seems to work okay kind of a response. You might be familiar with this very durable pattern that at least in the 20th century and 21st century, voters tend to hold the president accountable for the performance of the economy. So if you look at there's various measures of economic performance. This is growth rate in GDP. When there is higher economic growth in the 2 quarters before the election, or basically during the election year, the president's party tends to get more votes in the general election. And 2016 was right on that line. It has tended to be a pretty durable pattern. Now, the irony is the president has little to nothing to do with the economy. Little to nothing, right? It's not there's no reason to credit the president with a good economy. There's no reason to punish him for a bad economy. He has almost nothing to do with it. But nevertheless, when things are good, the public tends to hold the president accountable. Or reward him. But they also hold him accountable for other kinds of policy outcomes. So wars that are going badly tend to result in lower performance for presidents who are running for re-election. both in 1952 and 1968, wars that, and 2006 for George W. Bush in the midterm elections. The voters do hold the president and his party accountable for other kinds of policy outcomes as well. And certainly in the case of how well a war is going, that's much more in the president's control as commander-in-chief. And then there's some things that people hold the president accountable for that just, they don't even make as much sense as the economy. So here's some data from the 1912 presidential election from different counties in New Jersey. There had been a series of shark attacks at New Jersey beaches in the late summer of 1912. And there's a very robust relationship between, was there a shark attack on my beach? And are we gonna vote to re-elect the current president? And so voters have punished presidents for droughts, for flooding. Definitely not the president's fault that those things happen, but the public just says, I don't like it, I'm voting against this guy. So, to the degree that what the president currently faces is a series of enormous interrelated challenges, including an uncontrolled pandemic and a massive loss of employment associated with that. People have lost their jobs, they've lost their incomes, they're in danger of losing their housing if they're evicted, right? There's sort of both, like it's sort of a perfect storm of sort of death and economic dislocation, and that would be very hard for any president to, succeed in that kind of environment. And so it probably is the case that what we've seen in recent months with, sorry, I've got a pen here somewhere. What we've seen in recent months with the president's approval rating taking a dip down to one of its lowest levels since he got elected, around 40%, and his disapproval ratings going into into the 50s. That's not a situation those are the kinds of numbers that probably will affect the presidential election. There's no reason for them not to. That doesn't mean that it's necessarily going to affect the election. The election hasn't happened yet, and there's many months from now. But this is the kind of thing that the voters do seem to be holding the president a little bit accountable for how the country's doing right now. But, even given how poorly everybody feels the country's doing, 40% of the public still thinks this president is doing a good job, which points to the next thing that we need to talk about, and that is voters tend to see the performance of public officials through a partisan lens. The American public, most people, you may hear such things that, well, there's a lot of independents, or I'm an independent. Most people aren't independents. About 10% of the American public, and it's been consistent for decades, is something like a real independent. Everybody else has a psychological attachment or affinity toward either the Democratic or Republican parties. And not only is it an attachment, it's also a screen through which we all take in all kinds of political information. And it's a useful heuristic for us. It's like, I don't have to evaluate independently. I don't have to, I should, but I do not have to independently evaluate every candidate for every office, for county, for city, for state, for federal office. I can get a pretty good idea of the kinds of policies that they'll pursue and values that they'll, champion just by knowing what party they're in. So it's useful for voters. But on the other hand, it also means that they're not necessarily going to objectively evaluate whether the president or any other public official is doing a good or bad job. So for example, this is just the last couple of decades, but these time series go back to the 50s and look pretty much the same no matter what you look at. This is the number of strong Democrats and weaker Democrats who always vote for their party's candidate for president. And it's always better than 3/4 of them, approaching 90 or 100% some years, of people who have you just ask them on the phone, hey, do you lean to one party, or do you call yourself a Democrat? People who say they call themselves Democrats, including people who lean to one party, will give answers like these. Same for the Republicans. 3/4 to 100% of party identifiers will vote for that party's candidate, and it doesn't matter what they do. You could see that here with President Trump's job approval ratings, they have rarely dipped below 80% among Republicans, and they have rarely gotten out of the low single digits among Democrats. Right now, I think his approval rating among Democrats is about 3%, and he's hovering in the low 80s among Republicans. That's normal for any president in the modern era, but it means that, are we really holding anybody accountable with these kinds of patterns? To bring this back to the pandemic a little bit, this partisan attachment affects the way that we take in information. And, when the President of the United States is talking about the pandemic, our partisan affiliation also is a screen through which we take in the information that he is telling us, and that Nancy Pelosi is telling us, and that Gavin Newsom is telling us about the pandemic. And so we can see here that during that little while in March and April, when the president was on television every day talking about the virus, and he closed the country, and his order, and he was sort of taking credit for the shutdown, and we're doing the right thing here. There was very little partisan difference among Democrats, between Democrats and Republicans, on whether they avoided contact with people, whether they socialized, whether they wore a mask, and mask wearing was just starting to take off during that time. But what we've seen in recent weeks has been more of a dissociation between the parties, where now we see Republicans more likely to be socializing in person, Democrats less likely to be doing so, because we don't constantly reevaluate from scratch, all the information that we get. We don't have the tools or the time or the bandwidth to do that. We rely on these really simple associations with our party to decide who are we going to trust. So to get back to the question about whether the American public effectively uses elections to hold public officials accountable, and how do they respond to crises, sometimes there can be an insider-outsider rally effect, where we rally around one leader in our country against others. But that does not seem to be taking place this time. Certainly it's the case that we rally, that we input all kinds of political information through our partisan lenses. And then, to the degree that we can get beyond that and look at things that are happening around us, is this good, is this bad, should we reward, should we punish? The way we take in that information is pretty simplistic, and it's even there. It's are we really? If we're just looking at the economy and the president has nothing to do with the economy, or we're looking at, gee, I'm scared to go in the ocean because there was a shark attack, that's the president's fault, right? It's not necessarily the case that even if we can get beyond party identity, we can do a terribly good job of rationally holding the government accountable for its performance through elections.
I'm Dr. Justine Farrell. Like I said, I'm in marketing, and I'm going to just chat about consumer behavior today and talk about how we've seen a little bit of an irrationality around our consumption behaviors surrounding really this crisis, and based upon the fear and uncertainty that we're feeling. So just a quick overview of what exactly consumer behavior is for those that aren't familiar. It really involves the psychological events of thinking, feeling, how we behave. So all of our behaviors in the marketplace will culminate into a sense of value. It's the value that we're getting out of the marketplace, the value that we're getting out of interacting with other individuals. And so the broad definition of consumer behavior, and I know that it's quite wordy up here in the top, but it basically reflects all of our decision making as we acquire a product, service, idea, as we use that, and then as we also dispose of that. And so it's through the entire consumption process. And it's not just about us buying a product. It's us about buying a product, engaging in services, talking about how we use our time and how we interact with time through the consumption experience, and then also about ideas. And so today I'm going to be talking through those 4 different elements of goods, services, time, and ideas, and how this pandemic has actually affected us and the way that we are navigating our consumption behaviors through those 4 different elements. What we should and need to know is that consumers are inherently irrational. If you take economics courses or study within economics, everything is typically based in the rational individual. But when we practice consumer behavior, all of our decisions are just inherently irrational. It's hard to have that human element and stay 100% rational. And so this image I have here is of consumers on Black Friday. And you can see people fighting over these televisions. Inevitably, every single Black Friday, there's stories that come out of fistfights and mobs and angry arguments that occur over silly products like a TV that you can get at any day of the year. And if you track sales, there's Labor Day sales, there's Memorial Day sales, there's post Black Friday sales, there's summer sales. There's sales all year round, but we see for some reason we all go crazy over Black Friday. We're typically not getting better deals on Black Friday in all reality, and you end up spending more money than you normally would on Black Friday because you think you are getting a lot of deals. And so consumers over time are just generally irrational, and we're seeing this irrationality spike through the pandemic as well. And so that's what I'm going to talk about. And a lot of the irrationality that we're seeing is based in fear and uncertainty that this pandemic has been placing upon us. And so we see that the consumer buying patterns change because of insecurity. We are all placed in this sense of we don't know what's happening, we don't know how to stop it, we don't know when it's going to end. And with that, we all feel very insecure. With the past 3 presentations that you saw, this is kind of the perfect way to end cap this discussion of, I don't think any of us feel much better after this. We kind of see that this isn't ending. We don't know where the world or economy is going to be from this. And because of that, we all feel very insecure. And when we feel insecure, we seek comfort. And so we're all in this uncomfortable world state. And a lot of us use the marketplace to try to feel comfortable, whether that's based on our habits or based on what we're used to engaging in. We're grabbing for these straws to be in a more normal world and a more normal society. And part of that relates to our self-identity. And so we're trying to interact with the marketplace and purchase products, goods, services to make us feel more consistent and to get us back into that self-identity state that we were at even in February. And so a lot of that, there is some terminology here, but we will be engaging with the marketplace in ways that either make us feel connected to how we are affiliated. So whether that is you as a student or you as a Gen Zer or you as related to your family route, and that has to do with state distinctiveness as well, relating to either your racial grouping or your economic or income grouping or your age grouping. We'll also be purchasing items to verify who we are. And so I was actually just at Target yesterday, and the school section is huge. There's a whole area in the back of the Target that had folders and pencils and binders and everything that people need to go to school and prepare to school. And we don't know if school's actually even going to happen at the elementary school, middle school, high school level. USD is doing everything that they can to make sure that you're able to come to campus and be in the classroom. But we also don't know if that really will be happening yet, for sure. But our buying behaviors are signaling, let's be normal, let's get into normalcy because it helps decrease our insecurity. And so, okay, we'll start with the consumption of goods. We're seeing a lot of different behaviors surrounding mask purchasing and mask usage. And so this is the typical mask that we see. It's plain, it covers. We may pick our favorite color, but there's nothing interesting about that. But we're also seeing different masks that have a lot of imagery and different icons and usage for it. A lot of people are getting fun beyond just the colorful aspect of it. And we're also seeing goods that are more functional in purpose as well. This is actually a mask that is used to help facilitate communication with the deaf community. A common problem and unintended consequence that we're seeing with mask usage is for people that have trouble hearing or are hard of hearing aren't able to read lips anymore. And we don't really realize how much we read lips in communication until that's taken away. And you can hear people quite clearly through the masks, but if you're relying on those cues to be able to understand and communicate, the masks are actually very hindering. And so we're seeing the institution of masks with the clear cutout around it so that deaf are able to understand and communicate through that as well. And so with the element of goods, we're seeing that people are increasing buying because that leads to a sense and the feeling of control, which leads us to a sense of comfort. And so there's a heightened state of what we call morality salience, which basically means now I realize I might not be okay health-wise. We're starting to see perhaps our grandparents struggling with their health, or our parents if they have comorbidities or some underlying health conditions. We're starting to realize that we may lose loved ones through this. And it leads to this, what we call existential anxiety of what does our world mean to us? What do we mean? How am I living? And we're taking things for granted a little bit. And so we're starting to purchase goods because when we don't feel comfortable, we try to reach for what will make us comfortable. And so we've been seeing a lot of really kind of funny patterns emerge from products that we've been buying. So we've seen a lot of stockpiling behavior. This was very prominent in the beginning of the pandemic, and it's tapered off. We're seeing goods in stores, but we have, products that we're stockpiling. We've seen a lower quantity available in the stores of the very obvious rational items: hand sanitizer, Lysol and wipes, and bleach. Those will help us through this pandemic. The CDC is coming out that Lysol, is approved to actually kill the COVID-19, and so people buying these items are rational, expected. Then we had this middle ground of goods where we saw people driving to the store, purchasing in bulk quantities, but there's this quite a question of why are people buying this in bulk? We don't, a lot of jokes and memes were saying COVID's not an intestinal disease. You don't need that much toilet paper, which funny enough, we're starting to see it actually is one of the symptoms, but we don't need this much toilet paper. We don't need that many canned goods. Why are people buying so much? And a lot of that is coming from this sense of control. It's a sense of fear of we don't know what's happening. And so what if we are extremely quarantined and I run out of food? I want to have canned goods in the event that I'm told I can't leave my house, which again is an irrational thought of not being able to leave the house, but we're still feeling that uncertainty. Fresh meat alternatives. There was a kind of strain going through that we're going to run out of meats. I personally had a friend back on the East Coast that bought $1,000 worth of chicken and steak because she had heard that the meat plants were shutting down and she didn't know what she was going to eat. So now she has a freezer full of meats. And then bottled water was also one where, our water systems aren't contaminated. Our water systems are fine here in the United States. We can drink water out of our tap without getting sick. But still people were having a run on bottled water because they thought that the water might run out. And then we had on the far end of irrationality a bunch of products that were cleaned from the stock shelves or people were buying up that are really rooted in irrationality. We've probably seen on Instagram and social media about banana bread recipes going rampant and people baking bread at home. A lot of that is a little bit of like a boredom. What else are we going to do in our house? But the stocks were cleared of cookie dough. Of oat milk was one of the highest selling items and the items that were really tough to get. I even as a consumer behaviorist, I don't know what the deal with oat was, but oat milk was very popular. Kombucha was also another one that left the shelves that I can't seem to explain or rationalize. And then the other funny thing is puppies. A lot of people got dogs during this pandemic, which I think if you're going to buy something, a puppy is, if you're equipped to handle it, kind of something good that'll lift our spirits. But we did see a spike in sales for puppies as well. And so we're seeing from the rational to the irrational consumption of different goods. As we talk about services, the service industry is actually seeing success in this. So kind of this is the normalized area of services where healthcare is picking up. Obviously, financial services have seen success. Food delivery, we've transitioned to being afraid of going to the grocery store. Now we're seeing a lot of success within food delivery. When we look at the stock market, we see here, there was a dip, of course. We did see stocks really crash for a period there in March and April, but they've climbed back up. We're not at our pre-COVID peak yet, but our financial institution is doing a little bit better. And we've seen some service industries really outperforming our pre-COVID range. So Zoom has really skyrocketed. I joke that I really wish that I had bought a lot of Zoom stock when this first hit, and then it dipped, and I was like, oh, I'm glad I didn't, and then now it's exploded. So if anyone has invested in Zoom, you're doing pretty well. Now, Grubhub has actually seen better performance in the market than pre-coronavirus as well. And so a lot of service industries are actually doing well in this market and not hurt as much, because this is kind of their heyday, is getting consumers to be in a little bit more of a normal space. You may recognize this from Dr. Wanic's presentation. We're pulling the same point, which is pretty funny. But the more irrational side of the service industry we're seeing is based on self-identity and around haircuts. So again, the same exact image that we pulled from the article of individuals staging haircuts in front of the courthouse. And we see this in the frustration of not only people being frustrated, women being frustrated that their roots are growing out and their haircuts are growing out and I can't get in there, but we're seeing that specifically around haircuts because that is a part of our identity. And so I chatted about that a little bit earlier, is we are used to operating in a world where we can purchase items and use services that relate to who we are. And not only haircuts, a lot of individuals have actually been dyeing their hair crazy colors because we feel stuck and because we feel like we have no control over our situation, that what we can control are things that we can change. And so a lot of individuals have been playing with their hair color because of that sense of, okay, I can make my hair blue because I am making that conscious decision. The third element to talk about is how we're using time and how we're operating with time. And it's really this third point here on decision heuristics have been disruptive. And so what a heuristic is we make our decisions based on habits. And so you go to Starbucks because you always go to Starbucks and you're used to going to Starbucks. Coffee I'm a little bit of a coffee aficionado, so I personally would argue that coffee tastes different at different places, but coffee is coffee. Let's be kind of real about that. But we go to stores because it's our habit, because it's our routine. And the coronavirus has really disrupted that sense of routine in our life. I go to Starbucks every morning. I walk there. There's a local one to me. When they shut down, that really took my morning routine with my kids, kind of turned it on its head. And then we had to reevaluate and reassess what is our daily routine going to look like. And that's very frustrating and very disruptive to us. And we've seen this a lot with different generations as well. Generation Z, the younger generations where they were pulled out of school, or in college, all of the students were sent home mid-semester. And that was really disruptive, both in our sense of time and how that rolled over into our mental health. Older generations, the boomers, are struggling with this as well because they're retired, and so they don't have as much going on in their life, and their lives are based more on routine. The millennials and Gen Xers are handling this, if we want to say handling this a little bit better, because they are in the workforce. A lot of our work has turned remote, but we're still working. And so we see a little bit less of a frustration and disruptive element to it. But if you are joining my discussion session tomorrow, we're going to talk about this and how it's affected the different generational units. And then the last element is how it's affected our ideas. And this is one of the biggest problems, is a lot of ideas have spread that aren't accurate. So we're seeing that coronavirus is less deadly than the flu. A lot of ideas are being spread that there's no need to quarantine, there's no need to wear masks. The flu is just as contagious and we don't have to do this with the flu, so why are we even bothering? We're seeing ideas spread of that you can kill the coronavirus in the microwave, and so that has changed our consumption behaviors as well, and our behaviors in our home, of people putting their mail in the microwave and it'll be fine. You've seen the conspiracy theory, I'm sure, that this was because of 5G, and you know, the AT&T is behind this, and then the government's behind this, and they're implementing 5G and it's spreading the virus that way. And so a lot of people have really been afraid of using cell phones. This report here is they're burning cell towers because they think it's that. And then there's another kind of from the public health that breast milk boosts immunity. And so while that is true, and Dr. Barger, I'm sure, would attest to that, if you drink breast milk as an adult, you're not going to boost your immunity from coronavirus. So some adults were trying to get their hands on breast milk to try to circumvent that. I saw that with certain water. There's like alkaline water. If you drink that, your system becomes alkaline and you won't catch COVID-19 either. So there's a lot of ideas spreading, which is dangerous because people aren't getting accurate information, and so then they're reacting and acting in the marketplace in a different way. And so in marketing and consumer behavior, we talk about contagion and how ideas can spread and how that can be really dangerous. And so I have this little meme here that goes from Tom Hanks having the coronavirus to now all of a sudden Woody from Toy Story has the coronavirus as well. And how misinformation can really spread. And that's something that we need to think about and be cautious of, especially when we get into the internet. And so we operate online, we're on Facebook, you see one post based on Facebook, you tell friends, those friends tell their friends, and that's really how ideas spread in a dangerous way. And because of that, all of our behaviors start to shift when those claims and when those ideas may actually be pretty baseless. So I encourage you to think about this over today and over tomorrow through our discussions. And what I'm personally going to be talking a little bit about is how our consumption behaviors have changed significantly since COVID-19 hit. And if you're acting a little bit out of fear and out of that irrationality component, or if you feel like you've really been handling this situation as rationally as possible. So we're talking about different ways that we've been a little crazy, for lack of a better word, throughout the past 3 or 4 months that we've been dealing with this.
Dr. Dominguez and I have been hard at work kind of compiling your questions, but this group, the professors, have a few questions that they want to start with. And the first one is, what does this collective panel recommend? What should the powers that be do to prevent the ill effects from happening? And how do we make rational voting decisions? How do we avoid things like hoarding or stockpiling items in an irrational way?
I don't think there is any one answer for what can we do, but I think that what it starts with is having good leadership that sends a clear message from the beginning. And in terms of what I was talking about with respect to individualism versus collectivism, different messages, the same outcome can be framed in different ways. And so kind of, Justine at the end was showing a little bit about masks and, people having this ability to like express their individualism with masks. So getting some like buy-in from some popular influencers to wear masks and make masks cool and trendy as a way to, even though everyone would be conforming by wearing the mask, but to make you feel like you were doing it in a way that heightened your individualism would be one way, just for that simple behavior to get more people to buy into it. But I think a lot of what we're seeing in terms of the people not following guidance is there's mixed messages about what is and is not effective. Leaders are arguing with other leaders about what the appropriate or inappropriate thing is, and not following the guidance of people that are actually educated in these matters, rather choosing ideology or the need to maintain power as the starting point for decision making, which we see is creating significant amounts of problems.
I would agree that it's really important that we have sort of a clear, uniform message that we repeat repeatedly. And I would totally agree. I mean, I was thinking, you know, to get young people, you have to get buy-in, get some popular people. I mean, you know, when we're in a war, what do? We go and find Hollywood and ask them to produce things to get the message out that you're supposed to, you know, put your tin someplace, or don't use, you know, butter or whatever it is. So I think but the issue, I mean, to be fair, the issue is also we don't know all the right answers for this particular disease, right? So there's a lot of unknowns, but I think part of the problem is we're sort of, you know, very clear cut about this is the way it is, and then we're finding, oh, maybe it's not that way. So the over-promising, being overconfident about what we knew and didn't know has come back to sort of haunt us a bit. And yeah, I'm not going to be controversial, but you know, the main epidemiologists are saying we don't really know how effective cloth masks are. There's really no studies about cloth masks. But given that it may prevent someone from spreading the virus, it's a very low intervention, low cost item that we can encourage. So that's what I would say.
Yeah, I would add, you know, we have a very individualistic, nonconformist, you know, culture in the United States, our political culture. Our entire notion of citizenship is you can't tell me what to do, leave me alone, rather than as some other countries conceptualize citizenship, what are I am freedom, but with that comes responsibility. And so, you know, it was always going to be hard to get Americans to think about responsibility, but there was a while there where there was no partisan difference in behavior. And that was the while when, you know, there was an emphasis on us versus the virus, and you know, we're going to take the best science that we can. And to Dr. Barger's point, the problem of building trust is a significant problem, especially in a hyper-partisan time. And public officials have to work to build that trust, and they do that by being honest and by saying, this is what we know and this is what we don't know, and this is what, you know, we all want to get to this place where we have people going to work and nobody dying, which, by the way, lots of other countries have managed to get to that point, and we have not, in part because of our politics, unfortunately, but it didn't have to be that way. And so I think, you know, public leadership can do a better job of trying to build credibility by engaging with science in a productive way, and not in a power-seeking way.
Great, excellent. The next question is about irrationality, and as a lot of you guys talked about, we're all irrational at times, and is it really a bad thing, or is it something that we need to address, or never be irrational? What are your thoughts on that?
You know, it's not a bad thing. I think it has a bad stigma to it. I think, you know, people are like, oh, you're being so irrational. And the reality is that everything is irrational. You know, rationality is kind of an unattainable construct that, like I said in my talk, we talk about in economics, in the study of economics, because it's easy and it's clean. But what I personally love about being in marketing and consumer behavior, and I was actually, before being a marketing major, was a psychology major, was that every individual is different. And so I think that's what makes it fun and that makes it interesting. And I think to observe your own irrationalities, you can laugh at them. We see it in every point in life. There's no way that every decision you make is exactly the same decision that you've made in prior decisions. And I think it's a little bit more of an interesting case study instead of thinking of it as something that, oh, well, if everybody just act rationally and wore their masks, you know, similar to what Dr. Barger said, that may not actually even be a rational decision to wear a mask, because we don't know scientifically that that's been proven. But we're operating in this way because we think it might help. So no, it's never a bad thing.
I'm going to disagree, because I think that irrationality can actually be a quite bad thing. But I think, like what Justine is saying, is it's impossible for humans to behave rational at all points in time, and to always malign irrationality is not necessarily productive. From the ed-psych perspective, there's actually research evidence showing that some amount of irrationality in terms of the way that we process information is actually valuable. And some of that irrationality comes from the fact that the environment that we evolved in is different from the information processing environment that we find ourselves in presently. And so some of that irrationality is stuff that we can't get around. But I think the fact that we know that the way that we process and respond to situations is or tends towards irrationality in some ways that can potentially be damaging to the larger group, it's up to people to, one, educate themselves about the nature of that irrationality, to try to work individually to change their behavior. And it's up to governments and individuals that dictate policy to identify that, and therefore have policies in place that work to help people avoid engaging in the damaging irrational behavior.
I would agree with that. Just from the governance perspective, you have to, government has to take into account human behavior, right? You have to think, this is how people are going to behave. This is how we need them to behave. How do we structure their incentives to get them to behave in the way that's best for everyone? That's what laws are all about, right? It's like, we would like for our hospitals not to be full of people who've had their heads bashed in because they were riding a motorcycle and got hit by a truck. So we're going to require that they wear helmets. And you know, there's various ways that government tries to shape people's behavior, sometimes through requirements, sometimes through encouragement or structuring incentives or messaging. But you have to take into account the way people actually behave and not imagine that they're going to be fully rational at all times.
Great, thank you. The next question is about collectivism. And should we all be caring about each other? Is collectivism actually better than individualism? What are the panel's thoughts on that?
So I just want to, as just a point of clarification, collectivism doesn't mean that you care about everybody. It means that you care about the groups to which you belong, and it's typically not the whole entire group, it's some subset of the group. And there's actually some research evidence that suggests that people from collectivistic cultures are actually more wary and skeptical of other people's behavior, because their behavior could potentially be a threat to the overall functionality of the group. And collectivists, by and large, tend to have less close, less intimate relationships with other people. So it's not that collectivism is caring about other people and individualism isn't. Somebody had asked in the chat a question about individual collectivism and caring and charity. There are differences in charitable contributions from individualist versus collectivistic cultures, but it tends to be a function of how the charitable organization and the giving is framed. Individualists give more when they get personal credit for it, whereas collectivists give more when it's framed in terms of that this charity is benefiting the group. And if the group to whom you're donating, for example, can emphasize their focus on achieving group rather than individual goals. But the benefit of individualism, and then I'll stop talking, but I just want to say, like, the general benefit of individualism is the fact that it promotes nonconformity, and therefore it promotes more exploration. So innovation is much more likely in individualistic rather than highly collectivistic societies. And it's not that individualists don't care about other people. The nature of their behavior is just more oriented towards, what am I going to get out of it as a first pass at evaluating it, rather than what is the group going to get out of it.
Can I ask you a follow-up question on that?
Yeah.
So in individuals and in societies, could a society or a person respond in both collectivistic and individualistic ways and given certain situations?
I mean, yeah, the short answer is yes. I think everybody does at all points. This is one of the problems with, trying to put people into boxes, like you're an individualist or you're a collectivist. So for sure, I think that the groups about which individuals from an individualistic culture care deeply are the ones for whom people might make group-oriented choices. It's just that in many types of situations, somebody from a collectivistic culture is going to be pushed more, both personally and from the group norm, shifting them to make the decision that is more oriented towards the group. But for sure, people can make different decisions that square more with individualism or collectivism as they move throughout their daily lives. Absolutely.
Great, thanks so much.
In Singapore, in Korea, people were going to nightclubs and discos, but they were signing in with their real names and their real phone numbers in case someone there ended up having COVID, right? We would never tolerate that in America because of our privacy. Privacy is an individual right. You don't, for the government not to know where I went and what I did on Thursday night. And so that, that's sort of makes contact tracing a lot easier in those countries than in America, because you have a list of who showed up. And they tried it to a limited extent in Seattle, and people were up in arms, like, who visited this store? You had to sign in. So that comes from our individualist kind of approach. But I would agree, it also gives us sort of more creativity to explore new options. And so we sort of come up with a lot of ideas that are generated more so than in a collectivist society.
There's another dimension kind of related to what Mary was talking about, that's been used more recently to describe cultures, which is, are they loose versus tight? And it just has to do with how important is it for people to follow the group norms. And I'm actually moving to Singapore as soon as I can get out of the United States, as soon as travel starts. But I've already been told multiple times, when you come over here, you're going to be in quarantine for 2 weeks in this government facility. And I was reading all of the things that the dean was posting on the website for students at NUS. And the message from the dean to students is basically, stay in your effing room, don't go out. If you do, you're in trouble. And when I was reading that a couple months ago, I thought to myself, there is no way in hell that this would fly if a dean did that at a university in the United States. So what Mary's saying, where we as a function of our culture, which is not just the individualism, collectivism, there's a variety of other things, like valuing privacy and stuff over other things. There's a lot of policies that work in other countries that don't necessarily work here, but that doesn't mean that we shouldn't try something. It just means we have to think a little bit more, like Casey was saying, about what works in the situation, given what we know about the people over whom we're trying to make some type of change.
Dr. Barger, so I think there were a couple questions about how public health officials kind of look at various impacts in different demographics, and how there's an unequal spread and unequal impacts. and I think that we could even include the question about children in there, about those kind of impacts and how health officials kind of think about that. That ends up relating a little bit to a question for Dr. Dominguez about how voting behavior might be impacted by the risk factors of certain populations. But let's start with Dr. Barger.
Well, there's nothing like a pandemic to uncover the problems we have as a society. I mean, the social determinants of health are real clear. So the people who are low income are the essential workers who are going every day and being more out and exposed. They are not staying home, working from home, using Zoom, that kind of thing. And they tend to then have more comorbidities that put them at higher risk once they get the disease. There were some slides I went over, but it's very clear, and the Navajo Reservation has the highest rate of COVID in the nation, and at least 15%, probably more like 40% of their homes don't have running water. So when we're telling people to wash their hands frequently, what does that mean on a reservation when you don't have running water? So that's an issue. And as someone said, if a vaccine became available tomorrow, who would get it? And the answer is the people who should get it are the people living in inner city Detroit, the people who are the essential workers driving trucks. But who will get it? I think we can all guess who will get it, right? Just like Hollywood got the tests when they first became available. Children, this whole idea of children not getting the disease, the children get disease. The issue is the children can clear disease. And there's a lot of questions about testing, and part of the problem is our tests are too good right now. So I don't know if any of you have worked in labs, but when you do PCR testing, they are doing it, they're amplifying the virus fragments 40 times. So any little fragment that could be related to a coronavirus may be misinterpreted as COVID-19. And many people have had coronavirus. We've all had colds. So children are getting it. And so whether you have a positive test and you actually are a case, this is the first time we're saying people with a positive test are a case. And so it's a little confusing because a case is someone with symptoms versus a positive test could be someone who actually has some viral thing in the back of their mouth or the back of their nasopharyngeal cavity, but they can clear it. They may have antibodies that clear it, or they may have the second set of immunity, which are T cells, to clear it. So children are very efficient because children's immune systems have to respond to all these new things, that they've never been exposed to. So they have a very active immune system. And that's why they probably are not getting sick with this coronavirus versus old people whose immune system is just like worn out and they can't mount a response as well. So that's why the older people or people who are immunocompromised are getting very sick with the disease.
And there were some questions about kind of what is a partisan response, and also if partisan responses tend to encourage or discourage collectivist action versus individualistic action. And then there were definitely questions kind of about the access to actual voting, and if after the elections will be even more divided, or how you see that.
Yeah, just beginning with partisanship and what it, what it is. It's people acquire a partisanship sort of from the community that they are raised in. So if you're part of a community where there are a lot of Democrats and your parents are Democrats and they talk about politics at all, chances are you're a Democrat. It's the same way people acquire religion or orientation toward careers or anything else. It's sort of a sociological and community-based transmission of a set of ideas and values. And make no mistake about it, the two parties do right now, they're pretty different on their positions on ideology and on issues and the role of government and society and the role of the economy and the role of individual responsibility for behavior and that kind of thing. The parties are pretty different. And so, but people don't necessarily come to the two parties and say, which party matches my values? You know, unfortunately, most people acquire a partisanship in a more like inherited way. With the one exception being students about your age. So if you're coming to politics and you aren't already committed to a party, this is the period of your life where you would look at the two parties and their value systems and say, which one more, you know, matches my views, and then you would establish a habit of voting several times for that party, and then it's just the thing that you do every other November. And so that's what party is. It's a sort of a psychological attachment that's identity-based and community-based, and to some degree tied to the actual, preferences of the parties and what they do with power when they're given it. It also functions as an information screen. So, do you like Donald Trump? Whether if you have a partisan attitude in your background, that pretty much predetermines your answer to that question these days. Did you think that Barack Obama was handsome? Probably entirely determined by your party. Where do you get your news and information? Probably largely determined by your party. Not entirely. There's lots of places to get information, but there are great graphs. I wish I could show you one right now. I don't think I can pull it up quickly enough, showing that, right before January of 2016, 2017, when Donald Trump, took office and Barack Obama left office, Democrats thought, when Obama was the president, Democrats thought the economy was great and Republicans thought the economy sucked. 2 weeks later, they shifted. And that's what we mean by partisan information screens. And if you've got those rose-colored, Republican red glasses, or those blue-colored Democrat blue glasses, it's going to be pretty hard for any other kind of information to get into your brain that doesn't already satisfy your pre-existing beliefs about who's right and who's wrong in the world. That poses particular problems for, fact-based problems like the one that we're facing now. You asked, Dr. Peterson, you asked about what other effects on the election, like access to voting. Yes, that's an entirely different question. Will it be safe to vote in person? Will people decide not to vote in person because they're scared of standing in line? Or there were, I think, 79 people that were traced to have acquired COVID from voting in the Wisconsin primary, which was held mostly in person with only 5 polling centers for the entire city of Milwaukee, which of course is a majority minority city. There's very much the possibility that there could be effects on the way that the election is held. There don't have to be. There's plenty of people who are experts at running elections, Democrats and Republicans in every state and city in the country, who can look at, okay, if our goal is to get people safely to vote, there are ways to do that. It doesn't have to be it doesn't have to be either deadly or overly difficult for people to vote. And so part of that is a resource-based problem. If the communities are struggling with taxes because people are out of work and they don't have enough money, and the states don't pony up more money to pay for election services and to have more polling places and to have plenty of hand sanitizer at the polling places. If there aren't those kinds of proactive public policy solutions, then yeah, there will be problems voting. And we have a long history in this country of making it more difficult, especially for people of color, especially for Black Americans, to vote. A very long, gory, and disgusting history of doing that. And that will continue in some places, and in some places those kinds of problems will manifest just out of lack of resources as well.
Is there actually evidence around mental health benefits to consuming and those kind of the consumer, the shopping therapy, retail therapy that we have, I think was kind of what that question was going towards. And I think that will help us transition into the last question with Dr. Wanic.
Yeah, definitely. So mental health is a very complex and loaded topic. My dissertation was actually in grad school was actually on shopping addiction and a lot of compulsive behaviors. And so there is an important distinction between engaging in the marketplace to regain that sense of comfort and the traditional shopping and heuristics, and engaging in the marketplace in a disadvantageous way. And so it can really swing both ways. I think that there has been a lot of discussion and narrative around our mental health that's related to quarantine and being stuck inside. And there's a lot to say for social interaction, social engagement, and engaging with the marketplace in that way. But there can also be a lot of detrimental consumption behaviors as well. And so I would, in a blanket statement, say shopping therapy is not really a healthy behavior. I think if you are purchasing items on Amazon to make yourself feel better, there's some kind of a deeper issue, not each issue, but deeper elements going on there, that a good or service shouldn't be that stabilizing factor to you. But when you look at it from the lens of, I'm used to going to work every day and I haven't been, and I'm alone in quarantine in my house and I'm scared and feeling unsteady and feeling insecure, to re-engage with the marketplace in a way that's more normal to you does have good health, mental health benefits from it. But I wouldn't say, you know, for me, taking my kids to Starbucks every morning is part of our routine, and to break that routine has been detrimental, but it's not the buying of Starbucks that has been good for our mental health. It's more of the action and being outside and walking around the neighborhood and talking to others that's good for health, for mental health. Not my iced coffee, quite frankly. It helps with caffeine, but not so much the mental health component.
I agree with everything that Justine is saying. There is research that shows a temporary release of dopamine in response to buying something. So it does actually psychologically give you a high, but like Justine is, excuse me, I'm sorry, I keep calling everybody by their first name. I'm overly informal here. But like Dr. Rapp Farrell is saying, there's no long-term benefit of accruing anything from shopping online, and it can lead to a compulsion, and it can lead to using something to allow you to not address whatever the actual underlying issue is. A caveat being, I will tell you all that I just the other day purchased a dog anxiety toy for myself that is awesome. So some online purchases can actually help your mental health. Just saying.
All right, that was excellent. And Dr. Wanic, I think you clarified a lot of really important points at the beginning of our Q&A, and I appreciate you doing that. Thank you everyone for being here today.